It is time now for our KSAT Q&A. Every Wednesday, we are joined by Mayor Ron Nirenberg, who is joining us as well this evening. Mayor, thanks for being with us. We want to start with the confusion about the start of school. The information changes so fast, certainly frustrating to a lot of parents and school leaders that are trying to come up with a plan. We understand the city has now sent a letter to Governor Greg Abott's office. What is in that letter? What are you asking of his office?
Yeah, well, and let me start by saying we are just as frustrated by the confusion that seems to be par for the course for the Attorney General when he weighs in during this pandemic. But let me just say that our local public health authority, Dr. Wu, issued a directive about the safe opening of schools, again, distance learning until Labor Day at least, out of the direction from the governor's office as well as the Texas Education Administration. She issued that directive. Now the Attorney General has opined on that in contradiction to the governor and the TEA. And so we have asked the governor to set that straight, either reinforce our local public authority's directive or rescind it, which he has the authority to do under state law.
So are we basically in a holding pattern right now until we hear from the governor? I mean, Cornerstone filing a lawsuit today against the city, Northside filing a lawsuit against the state. I mean, there's just a lot of things at play here.
Yeah, and let me just state some facts real quick. The local public health authority has the authority to issue directives to protect public health and safety, which she has done. She has not dictated the opening of schools or closed schools. She has set conditions in place for safe reopening, which means that they can open, but they need to do distance learning, no in-person classes at 100% until after Labor Day. So, again, where we are with this is that directive has the weight of law, of authority that we are going to enforce. The Attorney General has opined on this and appears to contradict everything that we've heard from the TEA until yesterday, as well as the governor's office on safe reopening of schools. So we've asked for some clarity on this essentially. But until then, and even after this, what our public health authority has stated is out of a perspective of medical science to protect the health and safety of our community. And so her opinion on this is not going to change just because the political environment does. So, even if something changes with regard to how this authority works and the enforceability of this, you can't expect the public health authority's perspective to change about what can keep your children, our teachers, our community safe. So we have to just wait and see. But again, her guidance or her guidance is going to stay as it is today.
And yesterday we heard the city attorney, Andy Segovia, saying that the AG's opinion, which you have continued to say his opining on what schools should be or Metro Health should be allowed to do, is not a legally binding opinion. And so as of now, I want to make sure we're clear. As of now, you're saying that Metro Health is still telling schools they cannot open for in-person learning until after Labor Day.
That's right. Distance learning before that. And you're absolutely right. The Attorney General's opinion is just that. It's an opinion. It's an interpretation of the law. And he has had some very disagreeable opinions in the recent history.
All right, way to take a quick break. We'll be right back with San Antonio Mayor Ron Nirenberg. Back with San Antonio Mayor Ron Nirenberg. Mr. Mayor, it sounds like you're maybe a little bit more optimistic at this point with the coronavirus numbers and the hospitalizations and the trends that we're seeing than you've been in recent weeks. Would that be a correct assumption?
Well, I'm always optimistic that we're going to beat this, and we will. And it's going to require a lot of effort from everyone. And so that has always been my perspective and my forecast. But how much danger, how much illness we see in our community between now and then really depends on what kind of work we put in. And so today we're starting to see, as we have been over the last week or so, a little break in the data. We are going to see a prolonged plateau of this virus in terms of numbers, high level of infection, and also high numbers in our hospitals. And we're seeing that, but we're now beginning to notice a crest and beginning to come down. But I will tell you, all of that can change on a dime. If we're going to see the downturn in the data, if we're going to start to see fewer hospital admissions and begin to see the infection rate in our communities slow down, we're going to have to continue to buckle down on mask wearing and physical distancing. This is not going to end quickly, and it's not going to be easy, but we've got to work together. It's easy from an individual standpoint in terms of what we have to do, because these are relatively minor inconveniences about physical distancing, avoiding large crowds, and wearing masks. But it's not going to be easy in terms of us getting over it quickly. We'd have to continue to put in the work.
We have been looking at data and numbers for months now. The city is changing its presentation on those numbers. We got a little glimpse of that today during the daily briefing. So why is the city changing the way it presents the latest cases, and why is that important to give a better perspective of the spread here locally?
Well, I wouldn't say we're changing. We're adding some data to the daily updates. Now, from the start, we've been tracking the 7-day moving average on our epi curve, which you can see at covid19.sanantonio.gov. And you can see that a 7-day rolling average in terms of number of cases updated weekly. We're going to update that daily because we are at such high levels of infection, and you're seeing the case numbers daily jump so much, up one day, down the next. And the reason for that is that the daily cases are not really a reflection of who's getting sick in a 24-hour period. It's really about the data that's coming back from the labs. And as we know, there are delays in the national labs, there are delays in the private labs, and all of this data from an individual case standpoint is coming back at different times, different time intervals. And so that's what's causing the volatility. If you look at the 7-day rolling average, though, that's a truer assessment of the number of people who are coming down with this infection on a daily basis. And that's why we're going to report it on a daily basis now, in addition to the total caseload that we're getting in from the labs.
Got it. Mayor Ron Nirenberg, thank you for your time. Of course, we'll see you tonight on the Night Beat at 10.
Sounds good. Thanks, y'all.
We'll be right back.